Welcome to another comprehensive video on Alzheimer's disease. So, let's begin. Hello everyone, in this video we will explore the history of Alzheimer's disease. Types of Alzheimer's disease. Pathophysiology. Causes. Risk factors. Signs and symptoms. Epidemiology. And prevention of this disease. Introduction. Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills, and eventually, the ability to carry out the simplest tasks. In most people with the disease, those with the late-onset type symptoms first appear in their mid-60s. Early-onset Alzheimer's occurs between a person's 30s and mid-60s and is very rare. Alzheimer's disease is the most common cause of dementia among older adults. Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning, to such an extent that it interferes with a person's daily life and activities. Some people with dementia cannot control their emotions, and their personalities may change. History. Alzheimer's disease is named after Dr. Alois Alzheimer, a German psychiatrist, who in 1906 observed abnormal clumps and tangled bundles of fibers in the brain of a deceased woman, who had exhibited symptoms of memory loss and confusion during her lifetime. This discovery led to the identification of the disease that now bears his name. Types. There are two main types of Alzheimer's disease. 1. Early-onset Alzheimer's. Early-onset Alzheimer's disease is a type of Alzheimer's disease that affects individuals under the age of 65. While it is less common than late-onset Alzheimer's, it can be particularly devastating as it strikes individuals at a younger age and often progresses more rapidly. Early-onset Alzheimer's disease is typically caused by genetic mutations, although in some cases, environmental factors may also play a role. Mutations in genes such as the AP, SIN1, and SIN2 genes have been linked to early-onset Alzheimer's disease. These mutations can lead to the accumulation of beta-amyloid and tau proteins in the brain, which cause damage to neurons and interfere with brain function. The symptoms of early-onset Alzheimer's disease are similar to those of late-onset Alzheimer's disease and include memory loss, confusion, difficulty with language and communication, mood swings, and changes in personality and behavior. However, in early-onset Alzheimer's disease, these symptoms may be more pronounced and may be accompanied by other symptoms such as seizures or movement disorders. 2. Late-onset Alzheimer's. Late-onset Alzheimer's disease is a type of Alzheimer's disease that affects individuals over the age of 65. It is the most common form of Alzheimer's disease, accounting for about 90% of cases. The exact cause of late-onset Alzheimer's disease is not fully understood, but it is thought to be caused by a combination of genetic and environmental factors. While genetic factors play a role, they are not typically as strong as in early-onset Alzheimer's disease. Environmental factors such as lifestyle choices, head injury, and cardiovascular disease are also thought to increase the risk of developing late-onset Alzheimer's disease. The pathophysiology of late-onset Alzheimer's disease involves the accumulation of beta-amyloid and tau proteins in the brain, which form plaques and tangles that lead to the death of neurons and the deterioration of brain function. This process is thought to start years before symptoms appear and gradually progresses over time. Pathophysiology. The pathophysiology of Alzheimer's disease involves the accumulation of two proteins, beta-amyloid and tau, in the brain. Beta-amyloid forms plaques outside the neurons, while tau forms tangles inside the neurons. These deposits lead to the death of neurons and the deterioration of brain function. Causes. The exact causes of Alzheimer's disease are not fully understood. However, genetic factors, environmental factors, and lifestyle choices are thought to play a role in the development of the disease. Mutations in certain genes, such as the AP, SIN1 and SIN2 genes, have been linked to early-onset Alzheimer's. Signs and symptoms. Early signs and symptoms of Alzheimer's disease may include 1. Memory loss, particularly short-term memory loss. 2. Difficulty with problem solving and planning. 3. Difficulty completing familiar tasks. 4. Difficulty with language, including finding the right word or following a conversation. 5. Confusion with time and place. 6. Poor judgment and decision-making. 7. Misplacing items and difficulty retracing steps. 8. Withdrawal from social activities and hobbies. 9. Changes in mood and personality, including depression, anxiety, and apathy. As the disease progresses, additional signs and symptoms may include 1. Difficulty with basic activities of daily living, such as eating, dressing, and bathing. 2. Wandering and getting lost in familiar places. 3. Incontinence. 4. Changes in sleep patterns, including difficulty sleeping or sleeping too much. 5. Hallucinations, delusions, and paranoia. 6. Agitation, aggression, and other behavioral changes. It is important to note that some of these symptoms may also be caused by other medical conditions or medications, and a thorough evaluation by a healthcare professional is necessary for an accurate diagnosis of Alzheimer's disease. Treatment. The treatment of Alzheimer's disease focuses on managing symptoms and improving the quality of life for individuals living with the disease. While there is currently no cure for Alzheimer's disease, there are several medications and non-pharmacological interventions that can help manage symptoms. Medications such as cholinesterase inhibitors, donepezil, rivastigmine, and galantamine and memantine may be used to improve cognitive function and manage behavioral symptoms such as agitation, aggression, and depression. These medications work by increasing the levels of neurotransmitters in the brain or by blocking the overactivity of certain neurotransmitters that contribute to cognitive decline and behavioral symptoms. Non-pharmacological interventions such as cognitive stimulation therapy, occupational therapy, and music therapy may also be helpful in managing symptoms of Alzheimer's disease. Cognitive stimulation therapy involves engaging individuals in mentally stimulating activities to improve cognitive function and maintain social connections. Occupational therapy can help individuals with daily activities and maintain independence. Music therapy can help improve mood and decrease agitation in individuals with Alzheimer's disease. Lifestyle modifications such as regular exercise, a healthy diet, and social engagement may also help improve cognitive function and slow the progression of the disease. Regular exercise has been shown to improve cognitive function and decrease the risk of cognitive decline. A healthy diet, rich in fruits, vegetables, and whole grains, may also be beneficial. Social engagement and maintaining social connections can help reduce feelings of isolation and improve overall quality of life. Risk factors. The risk factors for Alzheimer's disease include age, family history, head injury, cardiovascular disease, and lifestyle factors such as smoking, poor diet, and lack of exercise. Epidemiology. Alzheimer's disease is the most common cause of dementia and affects millions of people worldwide. According to the Alzheimer's Association, more than 6 million people in the United States have Alzheimer's disease. The disease is projected to affect more than 14 million people by 2060. Prevention. While there is no cure for Alzheimer's disease, there are steps individuals can take to reduce their risk of developing the disease. These include maintaining a healthy diet and exercise routine, staying socially engaged, managing chronic conditions such as diabetes and hypertension, and avoiding tobacco and excessive alcohol consumption. Conclusion. In conclusion, Alzheimer's disease is a devastating neurodegenerative disorder that affects millions of people worldwide. While there is no cure, research continues to uncover new insights into the causes and treatment of the disease. It is important to raise awareness about the disease and to support individuals and families affected by this condition. Thank you for watching this video.